to Studio 5. The food you eat could be affecting your health, and you might not even know it. Dr. Robert Jones is with Genesys Medical Institute. How can food be affecting a person and they might not be aware of it?
Well, you're familiar with allergies. If you eat shrimp and your mouth swells up, that's a type 1 allergy. That's immediate onset. Type 2 allergy is you could eat like a banana today, and it might give you arthritic pain 3 days later. Or like we had one girl that was eating avocados every day. We ran the test on her, found out she was severely reactive to this, but it'd take 2 or 3 days before it would show up. So how would you ever know? You wouldn't. Okay, these are delayed onset food sensitivities, and the typical allergy testing doesn't show that.
Well, and something like arthritic problems, like you mentioned, that might show up 2 or 3 days later could be attributed to a number of different things, and at that point you're not connecting it to that banana you ate a week earlier.
Right. That's exactly
What sort of physical reactions are we seeing to these foods?
Oh, we see girls with terrible acne come in. They're eating something. We had one young man who he had been to several other doctors to see, why do I have this irritable bowel syndrome? One day diarrhea, the next day constipation, and always bloating, gas, things like that. Well, he had been tested. They couldn't find anything wrong with him. We ran what's called an ALCAT test on him. And when it comes back, it will rate it either severe in red, orange moderate, yellow is mild, or green, they're okay. There's no reaction. Well, one of his red foods or severe foods was corn. But he was eating Mexican food all the time, corn tortillas, and he was drinking pop, which has corn sweetener in it. So he never had the opportunity to feel better because he always had corn in his system. If it lasts for 3 days, as soon as we got him off the corn, and he has to stay off for several months, but immediately, within 3 weeks, his irritable bowel syndrome was gone.
So if an allergy test doesn't cut it, as you're describing, tell us more about this test. What is the process to really determine what foods could be causing you problems?
It's a very simple blood test. Person goes to the lab, they have it drawn, the blood drawn, then they go, that's sent to Florida, actually, is where the lab is. And they analyze it in a different way than an allergy test is done. Then they send us back this and some other things on a patient. It's very revealing because most of the time, when I slide this across to a patient and I have them read those foods, they usually gasp. Why? Because it's the foods they're eating every day. And you've heard the saying, one man's food is another man's poison. That's exactly what this test shows.
You took the words right out of my mouth. I was going to say, I guess a lot of patients are shocked to learn that something as simple as a banana or corn, like you mentioned, could be causing them such problems. So the blood test is the first step to identifying the problem. Then you work with patients beyond that to really treat the condition.
And it's not just, it can cause anything. Anything can cause anything. It could cause sinus problems. One of the things we see is with people that are overweight, these foods make them, if they're eating something that they're reacting to, it makes them crave more food. And people say, well, I just don't have the willpower to stay away from those foods. Not true. If this makes them physiologically crave those foods, they can't stay away from those foods. They're craving them 24 hours a day. If they cut these out, it makes it so much easier.
Well, obviously every situation is different. How do people get a hold of you if they have more questions?
GenesysMedicalInstitute.com, or they can go to foodmakesmefat.com and read all about it.
Okay, Dr. Jones, thank you so much for stopping by. We'll post that information for you on the Studio 5 website if you'd like to check it out after the show. Coming up next,